Let's bring in our chief medical correspondent, Dr. Jon Lapook. He speaks regularly with CDC Director Rochelle Wallensky and other top health officials. Dr. Lapook, so glad you are here. All right, let's talk about this because the CDC, using those words, the war has changed. What exactly does that mean?
Well, the war has changed because the enemy has some new weapons. It's more transmissible, it's more infectious, it's probably more deadly. Remember back in May when the CDC relaxed its guidance about masks? Back then, the Delta variant was about 1% of all cases. Now it's about 83% of all cases. And back then, the data suggested that if you were somebody who were vaccinated and you got a breakthrough infection, that you were probably unlikely to spread it to somebody else. Now, new information, new data out today from the CDC says that if you are vaccinated and you get infected nevertheless with Delta, you're probably just as likely as somebody who's unvaccinated and gets infected to spread it to somebody else. So the enemy changes its tactics, the CDC changes its tactics, just as it should.
I know someone personally that happened with. In fact, I want to show you, though, this graph also from the CDC. It shows just how much your risk decreases from getting COVID, being hospitalized from COVID, or dying COVID just by getting the vaccine. So that reminds us what? The vaccine is powerful.
These vaccines are very effective. You look at an 8-fold decrease in the risk of getting symptomatic infection. That helps explain what you mentioned earlier, which is that relatively few people are getting breakthrough infections when you think about the over 160 million people in America who have been vaccinated. And then you look at the amazing protection against severe illness, 25 times decrease in the risk of hospitalization, 25% times decrease in the risk of hospitalization, 25 times decrease in the risk of death. I mean, that's very effective.
And then what about people that are saying, wait a minute, I got the vaccine so I wouldn't have to wear a mask, and now you're changing the rules on me?
I get it. I'm empathetic. I feel the same way. Remember when we talked about last May when the guidelines were relaxed, we were feeling so good. But, you know, I'm still, although I'm disappointed, I am very hopeful. Think about how it was a year ago. We've come so far. We know so much more about how to treat it. There are therapeutics. We know more about ventilation and masks and testing. We have these amazing vaccines. But you know something? When the enemy changes its tactics, you've got to change your strategy, and that's why we all have to start rowing in the same direction. That's why the CDC, as the data changes, they're making new guidance, and that guidance today shows change in the mask guidance, and that's why the administration is saying you have to get vaccinated if it's at all possible.
Thank you so much, Dr. Lapook. Appreciate it.